Hi, I'm Josh, one of the transport paramedics and educators here in transport. So we're going to be making a series of videos going over the various pieces of equipment we have. Things like the vent, our monitor, the Alaris pump. Also reviewing some of our protocols, any updates, things like our standing order protocols. We'll be posting all of these over on a YouTube channel. So please check that out, because we'll be trying to post maybe a few months with new content. Welcome to the transport neighborhood. Hi, I'm Josh. I'm one of the transport paramedics and continuing education coordinator here at Children's National. Today we're going to go over the Aerogen aerosolized medication delivery system. So we're going to look at two primary functions of the Aerogen delivery system. One is intermittent use, and that's for use for 30 minutes or less, and one is continuous use for inline medications such as. So when you transition your patient on continuous, whenever you unplug to transition to the ambulance, it's going to switch itself to the 30-minute mode. Whenever you get back into the ambulance, you can replug it in. If it's been a short enough time, it's going to automatically go back to continuous. If not, you need to start over with holding down the button for 3 seconds to get back into the continuous mode. Before we do that, we're going to instill our medication. This chamber can hold up to 6 mLs. And intermittent use will be for 30 minutes or less. So once we're plugged in, we're going to turn it on. We're going to hold it for at least 1 second until we start seeing the medication delivery. So now we're going to go over the continuous setup for the Aerogen. It needs to start in the off position. So to turn it on to continuous, we're going to press and hold for 3 seconds. You see the 30-minute light up, and it's going to switch to continuous. So we're going to take, again, our controller cable, plug it into our Aerogen Solo. We're going to take our tubing for the Aerogen pump, screw it into the cap right here, and instill just a little bit of medication until you start seeing mist. Then we're going to set this up on the pump in a moment. So now let's look over how to actually drop the medication. So let's take an example of 10 milligrams an hour. If we see it's going to be 8 mLs of our albuterol, or 5%. So let's take our 8 mLs of that albuterol, put it into our Aerogen syringe. Dispose of our sharps. That remainder 40 mLs will be saline. Be sure to tip syringe end up until we have our full 48 mLs. We're going to blue cap it until it's ready for patient use. So to set up albuterol delivery on the syringe pump, we're going to go to our transport profile. We're going to select mLs an hour, confirm mLs an hour. Select our syringe type, our transport profile, that's going to be 3010, and we're going to be running it at 12 mLs an hour. Regardless of what our dose is, the rate is always going to be 12. We're going to confirm everything, mLs an hour at 12, and start. Now we're going to go over the inline setup for BiPAP. So we're going to take our tubing, regardless if it's the peds or adult side, set up our T-piece, fits into the side of the T-piece. Remember, the cup always needs to be facing up, it's gravity fed. Our Omniflex, or not Omniflex, feeds right into our blue elbow.